By now, we know the drill. Wear a mask, stay apart. But a bigger risk and reality was always there, even if the warnings weren't, that COVID is in the air.
And it's a tragedy that our infectious disease experts were following old science.
This story starts by going back to the SARS outbreak of 2003. Outside of Asia, Toronto was alone in fighting off a new deadly virus. The largest single group infected were healthcare workers. Mario Posamai was a senior advisor to the Ontario SARS Commission, set up to identify lessons learned. Its main recommendation: next time, play it super safe.
So the precautionary principle was made for COVID-19. When the science is mixed, you err on the side of caution. You protect people. You wait until the science is more solid to decide whether you can lower precautions. But we didn't do that.
Didn't do what China and other Asian countries would, treat COVID-19 as if it could spread in the air. That meant taking precautions against aerosols, tiny particles expelled when a person is simply talking that can travel in a cloud indoors and remain in the air indefinitely. Early on, China enforced strict airborne protocols, and healthcare workers donned full personal protective equipment, or PPE, including N95 masks that, unlike surgical masks, seal airways and block out most airborne particles.
We'd like people to limit their contact with people within 6 feet.
2 months later, in Ontario, a more traditional approach. Precautions here were based on a conventional model of how a virus spreads, mainly through large droplets within a range of 2 meters. The aerosol risk was recognized only during certain medical procedures. A different trajectory would emerge. In countries like China, infections among healthcare workers dropped dramatically. Here, they started to soar. In long-term care settings especially. Among those early devastating infections, a third were among healthcare workers, often equipped with little or no PPE.
Even the masks were locked somewhere. We did not have any access to the mask.
More than a year after she got sick with COVID, Rubina Khan still has trouble walking. Khan works as a nurse in a long-term care home. She was on a ventilator for 3 weeks and barely survived.
And afterward, my hair keeps falling. Whenever after shower, they try to comb my hair. There was big bunch coming out.
How do you think you got COVID?
Working with the patients.
But were they coughing on you or sneezing on you?
I did not hear anybody coughing. But now they are even saying, it's not just the droplet, it's the airborne.
Infections among healthcare workers kept skyrocketing.
One of the most difficult things.
Vicky McKenna is the provincial president of the Ontario Nurses Association. After filing multiple grievances, the ONA took the province to court to get more PPE.
They were told that, don't worry, you're fine. A surgical mask is good enough. And we were saying, no, that's not enough. We know it's in the air and that we need to err on the side of caution. They need to have the proper respiratory protection. How can it be that we have to go to court in order to do that?
As a result of that ruling, healthcare workers could ask for N95 masks if they wanted one. But unions say they kept being told they didn't need them.
I'm relying on our chief medical officer and the health table to give me that advice.
Meantime, the Ontario government insisted it was listening to the experts.
I feel like I've learned a tremendous amount over the course of this pandemic, and it's been humbling.
David Fissman is an epidemiologist and infectious disease expert with the University of Toronto's Dalla Lana School of Public Health. At first, he believed the droplet theory too.
This is a disease that's mostly spreading at short range, spreading via large respiratory droplets that don't travel very far, that masks aren't going to make a huge difference because nobody's going to be inhaling this virus, and that you're at very little risk of being infected by people who don't have symptoms.
But as Fissman studied early outbreaks on cruise ships, something didn't add up.
People being confined to their cabins were getting infected, even though they weren't in contact with anyone else who was known to be infected. So they were connected to each other by a ventilation system. That should have told us it was aerosol. And then what's emerged over the subsequent, nearly a year, has only sort of supported that model.
The warnings got louder. In July 2020, an open letter by 239 scientists, a global appeal to recognize the risk of airborne transmission. That same month, the World Health Organization did. But in a counter letter, infectious disease experts, among them advisors to the Ontario government, cited evidence the airborne risk may be overestimated.
There was more and more evidence of airborne transmission. And our infectious disease and public health experts, they wanted certainty. And whenever somebody raised a precautionary approach, they said, no, the evidence is not there.
If the precautionary principle is basically err on the side of caution, why not just invoke it?
There might be a bit of a higher cost. The only downside is that to make that decision to go that route would mean admitting that your medical orthodoxy is wrong.
The higher cost would involve rethinking transmission protocols in all indoor workplace settings. That didn't happen. A year into the pandemic, more contagious variants circulated and essential workers were hit hard. New infections were in the thousands for weeks.
Going into grocery stores and seeing staff protected with plexiglass and surgical masks when this is an airborne disease. Reading about workers at Amazon warehouses and factories and meatpacking plants who are not being properly protected.
What do you think would have changed?
Well, we would have increased emphasis on ventilation, air purification in our long-term care facilities, in our warehouses and meatpacking plants, and in our hospitals. We would have advocated that high-risk workers wear N95 respirators. And we would have really focused on making sure that they were protected at a higher level.
Only recently did federal and Ontario public health officials explicitly recognize COVID spreads in the air. No public announcements were made. We asked Ontario for an interview, but the province declined our request, saying it couldn't comment because a legal challenge against it was still before the courts, by nurses arguing Ontario failed its public health duties.
We have to do everything we can so down the road people will be protected and we will not suffer the same kind of infections and deaths in many cases that we've seen in this province.
I do feel angry, I do feel sad, but at the end, I am thankful to God that He gave me the second life.
How was your day at work?
It's fine.
Khan recently went back to work. There's plenty of PPE now, she says, including N95 masks.
I know they have everything available now, but it was supposed to be in the beginning.
We're 8,000 deaths in Ontario alone. What fraction of those deaths could we have prevented with good science? I think you're talking about thousands of people still being around who are not around now.
Posamai is calling for a national inquiry.
We're going to have other major public health crises, and we have to be ready for it. And we can't make these same mistakes another time.
History, it may already be fading, but there is still a race between vaccines and variants, and there will be a next time. Joanna Remiliotis, CBC News, Toronto.